Do you want to know what Kybella is and why is it done for double chin reduction? In this video, I'm going to explain everything about Kybella and how it's being done in a patient. Watch the video. So Kybella is a product that is designed to melt fat from the double chin. So for some people that has double chin, instead of getting surgery, you can get Kybella injections that melt the fat away. In my practice, I only encourage patients to do Kybella when they have a very teeny tiny double chin. Why? Because the downtime of the Kybella could be massive if you have a big neck. So for example, today we have this lovely lady, and as you can see, she has a really nice jawline contour, but she has a little bit of double chin. And she wants to get rid of that with the Kybella injection. This is the ideal patient for this procedure. Why? Because she is healthy, she is in normal weight, she only has a teeny tiny amount of double chin, and she doesn't want any surgery for that. So right now I'm going to explain you how the Kybella is done. So we have here our Kybella already prepared in syringes, and we need to do the markings. So because Kybella melts fat away, it also can melt the nerves. So we need to make sure that everything is done carefully so we don't have any side effects. So the first thing I'm going to mark is like a line that goes from the corner of the mouth, and it goes down here. And then I'm going to mark the jawline here in this area. And then we are going to mark, I need to make sure that the nerve that is in a structure that passes in this area, we need to make sure we're not going to damage it. So we do like a one line, like a 1 finger breadth below, like this. So this area is a prohibited area because here is where the nerve kind of passes by. Let's do this one here. I'm going to move this line a little bit here, and then we do like the finger breadth. It's going to be kind of this area, and where the neck breaks, that is the angle, it's going to be here, and this is the top part. So basically this is the area we're going to be doing the Kybella. So to make sure that everything is done correctly, the kit comes with a skin marking grid that is like a kid's tattoo that is going to let us know exactly where we need to go. So we open the kit. This is the tattoo. We're going to remove the kind of sticky part, and you see it has some dots, and it's going to help us to decide where to put the injections and how much Kybella we're going to do. So in this case, we're going to put it here based on the markings. So you see here, and you see it kind of mimics all the areas that we just did. So you see, here is where we can put Kybella, and in the white areas is where we need to spare the muscle. Sorry, spare the nerve. So let me fix this one a little bit more here. So this is the part that we cannot touch. So now, like when you were a kid and you have those removable tattoo, I have a gauze that is significantly wet, and we're going to wet the paper so the dots kind of stick to the skin. It would be cool if they come with dinosaurs or like some doggies. But no, this is like a color dots. So we need to wet this. And then once it's wet, we kind of start carefully lifting up to see if the dots are staying. Okay, good. Good. This one that's still attached. Good. 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 So you see, the guide is already there. But the fact that you have all those dots doesn't mean that you're going to be injecting all this area. Because she has very small neck, so we're going to remove some of the buttons because she doesn't have double chin here, it's more underneath the chin. So we're going to remove this extra dots. they come off easier with a little bit of alcohol. So I'm going to use an alcohol pad to remove this extra. See, the alcohol, they come out easily. Okay. Here, this is the line of the jawline, and this is the area that we need to protect. So this one, nothing here. So now we have the marks, and we are going to count the dots in the double chin area. So we have here 1, 2, 3, 4, 5. So one line in this square is a 5 dots. So 1, 2, 3, 4. 4 times 5 is 20. And we have here 2 cc and a little bit more. So this is 2 cc. This is going to be 20 cc. 20 injections that we're going to put here in the center, and then we also have a little bit extra. We have like a 1.3, so we can use 2 here and 2 here. So we're going to spare some of these ones. And the amount of Kybella that you inject at once depends on the patient's neck. In this case, on this patient, we're only using 1 vial because she has a very teeny tiny double chin, but in some patients they require 2 vials and sometimes 3 vials. So excellent. So now that we are done, I want to start doing the injection. There are different ways to do the injections. One of the most common one is putting just topical numbing medication. That is putting like a cream, like an Embla cream in this area. Let it sit for about 10 minutes and you do the injections. I personally don't like that technique. Why? Because it's painful. You don't feel the injection process because the skin is numb. So when you put the needle through the skin, you don't feel anything. But once you inject the liquid, that burns a lot. And it's very uncomfortable, and the burning sensation could last for a couple of minutes. So in this case, what I did is I put numbing medication, I injected kind of silocaine and let it sit for 10 minutes, and that's why you see the kind of white discoloration of the skin. That is going to last for a couple of hours. So now we have our Kybella injection, and we're going to do it at the level of the dots. We inject. Do you have any pain? No. That was the injection. Introducing the needle, and now we're going to inject the fluid. We're going to inject 0.1 cc close to each dot. Are you feeling any burning sensation? No. Excellent. So we're going to the second row. Here we have injected almost half of a vial. Now we're going to inject the other half from this side. So we're going to go to the third row. 1, 2, 10. So this is 1 vial of Kybella. Sometimes the vial comes with a little bit extra. So we have here like a 0.3 cc. So we're going to do it now outside here. So we're going to do a little bit here, a little bit here, a little bit in this dot, and a little bit here. Are you having any burning sensation?
No.
Okay, good. Excellent. So now that we're done, we're going to clean. I'm going to clean the dots with alcohol. it. And now the Kybella is going to start working. It's going to start kind of melting the fat away. The patient is going to get a little bit of swelling. We already did one injection on her several weeks ago, so she mentioned that she had minimal swelling, and this time it's going to be the same. So in conclusion, Kybella is an injection to melt fat away in patients that has double chin. Personally, I only recommend Kybella injections for people that have very tiny double chins, because in those cases the swelling post-injection is going to be minimal and you're going to have minimal downtime. In patients that have a big double chin, I highly recommend to undergo more chin liposuction, because the downtime is going to be much better than with the Kybella injections. I hope you liked the video, and if you have any questions, please let me know in the comment section below. I'm Dr. John Mesa, board certified plastic surgeon, and see you in the next video. Bye bye.